I am wondering how many of you have children who do sports. And I'm wondering how many of you are understanding that even the president has weighed in on the number of concussions that has been happening here in the United States. President Obama has been very clear that if he had a kid, he's not so sure that he would allow those kids, his son, if he had a son, he would allow him to go out there and play football. Listen to what he said. I'm a big football fan, but I have to tell you, if I had a son, I'd have to think long and hard before I let him play football. And I think that those of us who love the sport are going to have to wrestle with the fact that it'll probably change gradually to try to reduce some of the violence. And then he says, I tend to be more worried about college players than NFL players in the sense that the NFL players have a union. They're grown-up men. They can make some of those decisions on their own, and most of them are well compensated for the violence they do to their bodies. You read some of these stories about college players who undergo some of the same problems with concussions and so forth, and then have nothing to fall back on. That's something that I'd like to see the NCAA think about. And when we talk about problems, folks, did you know that it has been discovered that veterans of the NFL are more likely than the rest of us to die from brain diseases, including Alzheimer's, Parkinson's, and amyotrophic lateral sclerosis, known as Lou Gehrig's disease. Not 50% more likely or twice as likely, but 3 to 4 times more likely. It's serious business. And while we love to, oh my God, he knocked him, he really hurt him, you don't know what's happening in the inside of that cranium when they're hitting each other, whether it's NFL or college or even high school. You know, Pop Warner League, you see these kids running around hitting each other, and they're trained from very young. You knock a guy, you hit him hard, make sure he's scared of you next time you come around. I'm concerned about it. I'm pretty sure you are, and I wanted to talk to some people. First of all, my assistant, Emily Gelber, used to be a champion tennis player, and she was able to talk to some people and get. I want Emily. Thank you for coming on the show.
It's good to be here, Felipe.
All right. She got Dylan is on with us. Dylan's from Tulsa, Oklahoma. He's Ivy League and Division I football player who has played football for 11 years and suffered a career-ending concussion. How are you, Dylan?
I'm all right. Thank you for letting me on the show today.
Oh, thank you for appearing on it. And then we have Dr. Martin Goldstein, whose medical specialty is cognitive neurology. He's the medical director of the Mount Sinai Center for Cognitive Health. He serves as director of the medical student education in neurology at the Mount Sinai School of Medicine. He graduated from Cornell up in Ithaca. He was the Ronald Coles Fellow in Cognitive Neurology and Neuropsychiatry at Harvard Medical School and completed fellowship training in functional brain imaging at Cornell Medical Center. Whew! Heavy duty, Martin.
Good morning, sir.
How are you?
Good, thank you.
Let's start with Dylan. Dylan, I'm pretty sure that you loved football. You enjoyed the hit. I like physical sports. What happened and what made you stop?
Well, I have a very unique situation. I played football at Ivy League University. I sustained one concussion in high school. I got to college. I was perfectly fine. I sustained another concussion on a routine tackle during spring practice my freshman year. And it wasn't a big hit or anything like that. It was just, like I said, a routine tackle. And I stood up, and I felt kind of loopy, and my condition got worse and worse and worse as the evening went on.
What were the symptoms? What were the symptoms, Dylan? Were you dizzy? Did you have vertigo?
Vertical dizziness. Eventually, it got to a 5-second speech delay. I had to be hospitalized. I was conscious the entire time. They were asking me questions, but I didn't have the motor skills to answer them. They would say, move your hands, move your feet, and it would take me 5 seconds to do it. And then when I did do it, it was extremely weak.
I've seen that happen with boxers, Dylan. After they get hit, they go down, and they come back up. They don't quite know. They're conscious, but they don't quite know where they are. Dr. Goldstein, is that part and parcel of the syndrome of a concussion?
Absolutely. Some of those are the classic features that can occur after a concussion. often without any loss of consciousness, and sometimes the symptoms can be quite subtle and even covert, and hence why players can often return to play before they necessarily safely should. But classically, dizziness, vertigo, changes in language, response latency, as you just described, are fairly typical of a routine concussion in that context.
Give us a sense, Dr. Goldstein, of physiologically what happens when there's a major impact to the brain.
A number of things can potentially occur. One is a disruption of the electrical activity occurring on the cortex of the brain, which is the outside of the brain, as a consequence of the impact immediately. It's almost like, if one can imagine, hitting an old television on the side of the TV and disrupting the electrical function, so that the coordinated choreography of what's producing a
clear
coherent
image
picture exactly is disrupted. That's a useful analogy. There can also be changes that happen deeper inside the brain, affecting circuitry that mediates consciousness, and obviously when that gets affected, the patient can have a loss of consciousness.
Dylan, it is apparent to me that it was the second hit. The first one set it up because there was time between the first and second concussion. It was the second hit. Maybe you hadn't recovered totally, even after weeks or months.
Well, yeah, there was 4 months between 2 concussions, and whether I was symptom-free during those 4 months. You know, I made the conscious decision to come back and play football. I mean, I had a discussion with my doctors after the first one, and my coaches and my parents about whether I should continue to play football. And I made the decision that I wasn't going to quit, that I was going to give it another shot. And, you know, I worked my tail off to come back. Sure enough, in the first week of practice, I get another one. And at that point, I was able to have another well-informed discussion with my parents, my doctors, my coaches. And I never ran into any resistance about whether I should quit or not. I think everybody was on board with allowing
with
me
your
to step
decision.
away from the game.
Yeah, because there is a sort of a macho attitude. We saw that
Exactly.
with who was that guy who went? Was it Vic? Who was the guy that had the ankle problem, the right knee problem? Griffin. And they told him, these fools told him to go back in, and he said so. I would have told him, you'd sit down and keep quiet. We hope that he gets back into football. He's the greatest thing. He's a franchise unto himself. But what is this macho thing that says you got to go back after you've been hit so hard?
Well, actually, I think that this veil of machismo is starting to fade away in terms of concussions. Mm-hmm. You know, football players, they tell you, there's 2 types. There's being hurt and there's being injured.
Yeah.
And for a long time, a concussion was being hurt. You know, back when I was a kid, if you had a concussion, you come to the sidelines, they say, "Oh, well, can you spit?" Well, yeah. Well, then go back into the game. I think now that all this information is starting to come out, especially at the NFL and college level, coaches are being a lot more vigilant. Players are being a lot more vigilant about seeing concussions and then stepping out, and because they know the long-term detriment. And there's this.
Yeah, no, absolutely. I'm thinking, Dr. Goldstein, is the amount of padding in the helmet, is there anything that can prevent concussions? That is, could you put enough padding in there to prevent that from happening? I asked you this question right before I speak to Emily, who wants to weigh in on this too. What can we do to offset the injuries on the field?
It's a great question, and obviously a crucial one in developing ways to, as you described, these are sports that are dear to a lot of people, and developing ways to be able to preserve them in the ways that people find them most entertaining, and that's most rewarding to those who play them, but that can ensure an adequate amount of safety. So the answer is that we don't know what an adequate amount of protection is required yet in order to prevent the long-term complications of traumatic brain injuries such as those that occur in contact sports. The data is still coming in. This is a relatively new science, really just developing over the last decade. And disorders that have relatively recently been identified, like chronic traumatic encephalopathy, the types of brain changes that have been found in a number of high-profile cases, like those of NFL players who developed rather serious neuropsychiatric complications, even to the extent of suicidality. Those types of changes have relatively that have occurred in their brains have relatively been recently identified, and so determining how to prevent those, what kind of padding then can be implemented in helmets, and what other kinds of adjustments that need to be made to the game to prevent those types of changes remains a work in progress.
Emily, you researched this piece. We're speaking to Emily Gelber now, who's my assistant here on the program, and who goes to Brown University. Emily, you researched this. Did you find, what was your discovery? Did you find anything that made you say, wow, I never thought about this? In terms of, the doctor just talked about suicides. There was a very famous case of a football player who went and killed his wife and his daughter. He killed his wife. He left his daughter alive. People actually hurt people because of, I don't know if they're lesions or their hits to the brain. Were you shocked by some of your findings?
Well, having grown up in a competitive athletic environment, I was interested to find that the way that the NCAA possibly takes advantage of athletes. So you have any sport, even in tennis that I saw, which is not a high-profile sport, you have these top elite athletes that the schools recruit. And to essentially children, you're enticing them with scholarships and publicity, and they go to these schools and they're not given the same education as the regular students in the sense that they're told that their sport comes first. They're asked to make a dedication of over 20 hours a week and traveling, and they are told basically that their sport comes before their education. So they come, they get their scholarship, and then they leave with no proper skills to enter the workforce. Now you have football players that, on top of the fact that the education is substandard to the regular education of students, they're also suffering physical trauma that also leaves them at a disadvantage after graduating from college. I've
often said that. I think that there are so many kids in America who go into these sports thinking that they're going to be great NBA players, and they don't finish school. I saw guys in Rutgers Park. I saw guys in Brownsville. I mean, I saw guys dribbling with both hands at the same time. These were phenomenal athletes. They weren't given proper education, and once the knee goes, it's a wrap, Emily. It's over in terms of football and basketball. Skiing too. Did you? How did you handle injury? You had a horrible injury. You were almost number one in tennis, and you had to drop out, right?
Yeah, so I had won nationals at 14 years old, and I got to start playing professional tennis. And about 3 months after I started playing professional tennis, I had an injury in the weight room and herniated 2 discs in my neck, which essentially ended my career.
Damn. Dr. Goldstein, are there medical procedures that can alleviate the pain or alleviate some of the more deleterious effects of concussions?
That's also still remains somewhat unknown as the science continues to stream in on the consequences, both short-term and long-term, of concussion, repeated traumatic brain injury, sometimes even relatively mild. Essentially, the only thing we really know for sure at present is that the best way to prevent the complications of traumatic brain injury, the milder type of repetitive ones that can happen in sports, although obviously more severe ones can also happen, is to prevent recurrent injury, some of the second hit syndrome that was alluded to earlier in the conversation, that players can be especially vulnerable to if they return to play before resolution of the symptoms of the first hit, the first concussion. But there has been a gradual progression of development of management algorithms for players who've incurred head injuries in terms of managing them and optimizing their recovery and enabling them to return to play. Many of these are quite conservative, and they essentially involve rest, both physical and cognitive, even avoiding things like television, computer, texting, that kind of thing, until their brains have recovered to a normal level of function.
You mean to tell me that's why I get headaches when I look at too much violent TV? I've been hit in the head a few times. I wonder if some of my behavior has been affected by some of the hits I've had in the head, both from police batons and fights. I'm beginning to worry a little bit. But I think you're saying even cognitive, so that they can't. You're saying they can't think too much, they can't process too much.
Sure. Professional athletes, not only just football and ice hockey, the ones we typically associate with the types of head injuries we're discussing, but baseball and other sports. There have been important players, especially in the New York area recently, who've had in baseball, who've had head injuries, and they have had struggled with return to play until they were cognitively back to themselves.
Dr. Goldstein, the ball is coming at you in baseball 90 to 110 miles per hour. I don't care what kind of helmet you have on. You're going to get hurt.
That's correct. And I think that underscores what you said at the beginning of our chat, and that is that in many ways, as knowledge is accumulated regarding the effects of these head injuries on players' brains, and as President Obama also alluded to, that many of the sports we all hold dear may have to change, and in some ways fundamentally, to prevent very serious neurologic disorders from developing in these players.
Well, remember, the journal Neurology carried the results of a study of 3,400 retired pro football players. And it said that not 50% more likely or twice as likely to have problems, but 3 to 4 times more likely the football players were likely to have problems associated with the concussion. That's scary stuff. More than 3,000 former players have sued the AFL, Dr. Goldstein, charging that the league failed to inform them of the dangers they face, to protect them against concussions, and to provide health care. Nobody talked about getting a concussion when you start football. Remember, they only had one brace around the helmet, if you remember. These guys were working with minimal padding. In fact, a lot of guys wouldn't put padding on because they felt it restricted their speed. And unless you were like being called frilly names, you got back in the field as soon as you could locate, as soon as you can got your head clear. So it's been going on for a long time, and I can imagine how many men have died from Alzheimer's or developed Alzheimer's or committed crimes because of the effects of these hits. Dylan, do you think, what are you doing these days, Dylan?
I'm still at school.
And what do
I'm a student.
What do you play now?
I don't play anything.
Wise move, Dylan. Wise move. What do you specialize? What do you specialize? What's your major?
History.
Interesting. That's wonderful. Do you like it? Are you going to teach?
I don't know what I'm going to. I'll probably end up going to law school.
Smart man.
I have a couple of things. Yeah.
Smart man.
Go
ahead. I'm sorry.
No, I think Emily hit the nail on the head when they talked about. I just wanted to say that I think she hit the nail on the head when she talked about college athletes, and because I told you my situation was unique. Partly because in Ivy League universities, you're not on a football scholarship.
Yeah,
it's all need based, and a lot of these kids they do get these football scholarships, and they can't even have the same discussions that I had because they've been passed along through high school. They haven't really learned anything. They haven't been working towards a diploma or learning skills for a profession. The only skills they've been learning are football. So if they get a concussion, they can't even. There's pressure to not even tell anyone that they have a concussion.
That's right, Dylan.
Because they need film to get on to be drafted for NFL scouts to see, and it's a high pressure situation. I mean, that's their only future source of income, and there's pressure to not come out and be honest about your brain injury, so they can't even have the same type of discussions that I had with my doctor and my players and my coaches.
It's heartbreaking, Dylan and Dr. Goldstein, when you see these guys heroes of yours in wheelchairs or worse. John Mackey, the pioneering president of the NFL Players Association, was found to have frontal temporal dementia in his early 60s. Former Bears safety Dave Dwierson was 50 years old when he committed suicide. Do you remember that, Dr. Goldstein?
Correct.
And shooting himself in the chest so that his brain could be studied. It showed signs of CTE. Junior So, a 12-time Pro Bowler for the Chargers, was 43 years old when he shot himself in the chest last spring. This is insane, Dr. Goldstein. These people are going through it. No one's even thought about changing the law or change, at least the litigation, changing the compensation, if you will. Still, these guys are they must know, Dr. Goldstein, something is happening to them.
They do, but what's remarkable is it's really only within the last few years that it's been able to be demonstrated scientifically that something is in fact happening to them through post-mortem changes that are detected on post-mortem analysis at autopsy. But even more importantly and promising are ways to image the brain, new types of PET scans that are able to detect in some ways some of the pathology that can occur before having to rely on just post-mortem analysis. It's that data, it's that information associated with these very prominent cases, which is in many ways driving this process of trying to renovate how these sports are conceptualized in terms of the impact on these players' health.
Do you know something I was thinking about this, Dylan? You got hit in the head, helmet padded. Can you imagine what a kid in an urban area, what happens to a kid in an urban area when he gets beaten up by a cop? Dylan?
Yeah, I mean, I bet it's a little bit worse. I mean, I had a helmet on.
Of course. It's amazing to me. You had a helmet on, exactly. But I've seen kids beaten up. And I wonder, Dr. Goldstein, if we could extend the findings of football players, hockey players, and extend it to kids who are incarcerated. Because a lot of these kids end up, you see them, they're not... There's a dysfunction there. There's a gap between the thought and the speech. You see it happening all the time, and many of them have been beaten up by police. And of course, the police said, "Well, I didn't kill him." Well, you might as well have, because the beating with the baton, beating with these sticks, or with flashlights can cause concussions. Am I right, Dr. Goldstein?
Correct. How the actual impact occurs. Whether it's in a contact sport like an NFL player or in the types of injuries that you just described, is in many ways the context is irrelevant to the impact on the brain. The brain will incur injury or can incur injury. It doesn't happen necessarily all the time. Again, this is a relatively young science, so we don't know exactly how often, how universal the changes can happen. But much of the science is demonstrating that these changes are serious, that they happen as a consequence of even relatively mild head injuries, and that the person who incurred that head injury experiences fundamental changes in their personhood, their ability to think, their ability to control their emotion, their ability to regulate their comportment. So, correct, these injuries can fundamentally change that human being.
Well, I want to thank you, Dylan. God bless you. I wish you the best, Dylan. Over there in Oklahoma. Thank you for coming on the program. I want to thank Emily for having produced this piece. Thanks a lot, Emily Gelber.
You're welcome, Felipe.
And thank you, Dr. Goldstein.